Nearly 1,000 frontline healthcare workers received a long-awaited shot of hope this week with the first shipment of COVID-19 vaccines to Southwest Colorado. You're watching the Local News Network, brought to you by Target Rental in Durango and Cortez. I'm Wendy Graham-Settle. Southwest Colorado was the first in the state to administer its entire shipment of COVID-19 vaccines to frontline healthcare workers this week. The region received 975 doses on Tuesday, December 15th, and by Friday, every vaccine was starting to work its magic on immune systems. At Southwest Memorial Hospital, 150 nurses, doctors, and others who provide direct care to COVID patients took their shots of hope with smiles in their eyes.
My brother-in-law is an anesthesiologist at a university level 1 trauma center, and I got vaccinated before he did, so that's pretty exciting to me.
The long-awaited vaccines arrived as cases have surged dramatically in Southwest Colorado. Health officials blame the surge on colder weather that's driving residents inside, where small group and holiday gatherings have been the biggest source of new cases. As of December 13th, La Plata County reported a total of 2,193 cases since the first COVID-19 case was reported in Colorado in March. Archuleta County has 499 confirmed cases, and Montezuma County a little more than 1,000 cases. In late November, Mercy Regional Medical Center reported that ICU beds had reached 99% capacity, and the Four Corners Healthcare Center reported that nearly all of its residents had been infected. Southwest Memorial's Chief Executive Officer, Tony SUDDUTH, said hospital staff have handled the cases thrown at them, but they're exhausted.
It's the next step in getting to the end of this crisis, and we've been looking forward to something that's a real positive for an organization, for the community. It's we've got to see something to give us a little bit of light there. That everybody's tired. I mean, our staff is exhausted right now, and like this does show us. I mean, there's something out there that gives us some hope that we're going to get through this. We know it's a few more months, several months probably, before we get there, but this is a huge step forward.
Deploying the vaccine locally took months of planning, with logistics to rival a major troop movement.
It's a remarkable achievement to even get the vaccine here. Once it's here, it was essentially, this is how many doses are allocated to each facility, and then you guys got to get them there in the required amount of time. And so that has been a collaboration between San Juan Basin Public Health, our 4 regional hospitals, and the National Guard, and our couriers, our couriers who work for the state laboratory, who are coming together to plan out opening freezers, closing freezers, loading boxes onto trucks, arriving at facilities, unloading them, getting them into refrigerators to thaw, and then having them ready the minute that the first person shows up to receive their vaccine according to their appointment. All of that has been done just in the last several days by the hospitals, San Juan Basin Public Health, and the National Guard and our couriers.
Another shipment of about 1,000 doses is expected to arrive in Southwest Colorado starting December 21st. Healthcare workers in long-term care facilities and other medical workers will be the next to receive the vaccine. First responders and other healthcare workers exposed to COVID patients are next in line, followed by those with underlying conditions, residents who are 65 years old and older, and essential workers. Vaccines for the rest of the population are expected by early summer, but health officials said that vaccines don't translate into vaccinations and immunity from the coronavirus. You have to get vaccinated, and some health officials express concern that misinformation and fear about the vaccine's safety could prolong the pandemic. Dr. Ben CARELOCK, Southwest Memorial's chief of staff, was one of the first to get vaccinated, and he encouraged the public to do the same.
The vaccine did go through a full FDA approval process. It went through a complete clinical trial, and they didn't cut they didn't cut corners. And so I do trust that approval process. And 3, if you look at the history of vaccines, there's an incredible record of vaccination safety. There's almost nothing else in healthcare is as aggressively scrutinized from a record-keeping standpoint, the statistics standpoint, as vaccinations. And so just that generally has improved my comfort level.
COVID-19 vaccinations may have arrived in southwest Colorado, but don't take off that mask just yet. Health officials said vaccinations won't start making a difference in the infection rate until late spring or early summer. And that all depends on how many vaccines are delivered and when. Devine noted that masks and social distancing do make a difference. The biggest declines in Colorado COVID cases are in counties that are under Code Red restrictions because of reduced social contact. La Plata County's confirmed cases dropped from a high of 455 cases a week before Thanksgiving to about 250 cases a week as of December 6th. The county was placed on Code Red restrictions on November 20th. Code Red restrictions prohibit indoor dining and gatherings of people outside your household. Devine added that the longer residents wear their masks and practice social distancing, the quicker the pandemic will end.
We do think that it's really important for everyone to wear a face covering because it's the best way to keep our cases down, to keep our workforce in person, to keep our schools open, and to keep our economy strong. No matter what framework you want to look at it, mask wearing is a good idea and one of the most important things you can do.
To keep on top of vaccine deliveries and vaccination information, visit sjbpublichealth.org or swhealth.org. Thanks for watching this edition of the Local News Network. Let's all do our part to stop the spread of COVID-19. Please continue to wear your mask and practice social distancing for your sake and ours. I'm Wendy Graham Settle.